ever wondered if your liver is silently suffering? Your liver is one of the hardest working organs in your body, performing over 500 vital functions every single day. Yet, it's also one of the quietest when something goes wrong. Unlike your heart or lungs, your liver doesn't send obvious pain signals until damage becomes severe. Today, I'm going to reveal 7 critical warning signs that your liver is desperately trying to communicate with you. And warning sign number 3? It's so common that millions of people experience it daily without realizing their liver is behind it. Unexplained fatigue that won't go away. Let's start with something almost everyone experiences: fatigue. But I'm not talking about ordinary tiredness after a long day. I'm talking about profound, unrelenting exhaustion that doesn't improve with rest. When your liver is struggling, it can't efficiently process toxins and produce energy-sustaining glucose. This metabolic disruption affects every cell in your body. Your liver also produces proteins essential for blood clotting and nutrient transport. When these functions decline, your cells literally starve for nutrition, leaving you feeling drained. Studies show that up to 80% of people with liver disease report chronic fatigue as their first symptom. The problem is that most people attribute this tiredness to stress, poor sleep, or aging, never suspecting their liver might be the culprit. If you're sleeping 7 to 8 hours but still waking up exhausted, if coffee doesn't help anymore, if you need to nap during the day regularly, your liver might be sending you a distress signal. Persistent itchy skin without rash. Here's a symptom that surprises most people: unexplained itching, especially without any visible rash or skin condition. When your liver isn't functioning properly, bile salts can accumulate in your bloodstream instead of being properly processed and eliminated. These bile salts deposit under your skin, triggering intense itching, particularly on your palms and soles of your feet. This isn't occasional itching from dry skin or allergies. This is persistent, maddening itching that often worsens at night and doesn't respond to typical moisturizers or antihistamines. The medical term for this condition is cholestasis, and it's a clear indication that your liver's bioflow is compromised. Many people visit dermatologists for months, trying various creams and treatments, never realizing the root cause lies in their liver: abdominal bloating and discomfort in the upper right abdomen. Now we're at warning sign number 3, the one most people completely ignore. Pay close attention to this one. Your liver sits in the upper right portion of your abdomen, just below your rib cage. When it's inflamed, enlarged, or diseased, you might feel a dull ache, pressure, or fullness in this specific area. But here's why people miss it. They blame it on gas, indigestion, overeating, or stress. After all, abdominal discomfort is incredibly common. However, liver-related discomfort has distinct characteristics. It typically feels like a dull, aching pressure rather than sharp pain. It may worsen after eating fatty meals because your liver has to work harder to produce bile for fat digestion. You might also notice persistent bloating that doesn't correlate with your eating patterns. An enlarged liver, called hepatomegaly, can occur due to fatty liver disease, hepatitis, alcohol consumption, or medication side effects. Currently, non-alcoholic fatty liver disease affects approximately 25% of the global population, yet most people are completely unaware they have it until complications develop. Changes in urine and stool color. Your bathroom habits can reveal surprising information about your liver health. Let me explain what to look for. Dark urine that resembles tea or cola, even when you're well hydrated, indicates excess bilirubin in your bloodstream. Bilirubin is a yellow compound produced when your liver breaks down old red blood cells. A healthy liver processes and eliminates bilirubin efficiently. But when liver function declines, bilirubin accumulates, eventually passing through your kidneys and darkening your urine. Equally important, pale, clay-colored stools. Your stool's normal brown color comes from bile processed by your liver. When bile flow is obstructed or liver function is impaired, stools become pale, gray, or even white. These changes don't happen randomly. They're direct, measurable indicators that your liver's processing capacity is compromised. If you notice both dark urine and pale stools simultaneously, seek medical attention promptly. Easy bruising and prolonged bleeding. Have you noticed that you bruise more easily than you used to? Do small cuts take longer to stop bleeding? Your liver might be responsible. Your liver produces most of the clotting factors your blood needs to stop bleeding effectively. These include proteins with names like fibrinogen, prothrombin, and various clotting factors numbered 1 through 13. When liver function declines, production of these essential proteins drop. The result? Your blood doesn't clot as efficiently as it should. You develop bruises from minor bumps you don't even remember. Small cuts bleed longer than they should. You might notice increased nosebleeds or bleeding gums when brushing your teeth. Women might experience heavier menstrual periods. This symptom often develops gradually, so people adapt to it without realizing something is wrong. This is particularly concerning because it indicates your liver's synthetic function, its ability to manufacture essential proteins, is already significantly impaired. Yellowing of skin and eyes, jaundice. Jaundice is perhaps the most recognized sign of liver problems, yet people often miss its early stages. Jaundice occurs when bilirubin levels rise high enough to deposit in your skin and the whites of your eyes, creating a yellowish tint. But here's what most people don't know. Jaundice doesn't appear suddenly. It develops gradually. The earliest signs appear in the whites of your eyes, called the sclera. Before your skin shows any yellow discoloration, your eyes will develop a faint yellowish tinge. Many people miss this because they don't examine their eyes closely or attribute it to tiredness or lighting. As bilirubin levels continue rising, the yellow color becomes more pronounced, eventually affecting your entire complexion. By this stage, liver dysfunction is already advanced. Jaundice in adults always requires immediate medical evaluation. It can indicate various conditions: hepatitis, cirrhosis, bile duct obstruction, medication toxicity, or even certain cancers. Never ignore yellowing of your skin or eyes. Mental confusion and difficulty concentrating. Our final warning sign affects your brain, not your body, and it's one of the most overlooked symptoms of liver disease. When your liver can't properly filter toxins from your blood, these harmful substances travel throughout your body, including to your brain. This condition, called hepatic encephalopathy, can range from subtle to severe. Early symptoms include difficulty concentrating, problems with short-term memory, mood changes, confusion about time or place, and altered sleep patterns like sleeping during the day and being awake at night. These cognitive changes develop so gradually that people often attribute them to stress, aging, or lack of sleep. Family members might notice personality changes before the affected person recognizes anything is wrong. In advanced cases, hepatic encephalopathy can progress to severe confusion.
Hello and welcome. Today we will calmly explore 7 silent signs of magnesium deficiency, signals the body often whispers long before louder problems appear. This content is educational and does not replace medical care. If several signs fit your experience, speak with a qualified clinician and consider appropriate testing. Magnesium is a quiet hero. It helps more than 300 enzymatic reactions, from energy production and nerve conduction to muscle relaxation, heart rhythm, and stable mood. Yet many modern diets do not provide enough. Stress, poor sleep, alcohol, certain medications, and intense exercise can further drain reserves. Let's begin with sign number 1. Persistent muscle tension, cramps, or twitching. Magnesium supports the electrical balance that allows a muscle fiber to contract and then fully relax. When levels dip, muscles may misfire. Eyelid twitches, calf cramps at night, tight shoulders, or a clenched jaw. If you often wake with stiff calves, if your hands cramp while typing, or if small facial twitches appear under stress, low magnesium may be part of the picture. Sign number 2. Trouble falling asleep or staying asleep and feeling unrefreshed in the morning. Magnesium helps activate the body's natural brake pedal, the parasympathetic nervous system. It also influences GABA receptors, which calm neural activity. Without enough, the nervous system runs hot. You may feel wired yet tired, tossing and turning, waking at 3 a.m., or needing caffeine just to function. Sign number 3, anxiety, irritability, or increased sensitivity to stress. Stress burns magnesium quickly, and low magnesium makes stress feel stronger, a frustrating loop. You might notice a shorter fuse, heart flutters under pressure, or difficulty relaxing after small triggers. Restoring magnesium commonly softens these responses and steadies mood. Sign number 4, headaches and migraines. Magnesium helps regulate blood vessel tone and stabilize nerve signaling. For some people, low levels mean more frequent tension headaches or migraines, especially around stress, dehydration, or hormonal shifts. If your headaches cluster with poor sleep, muscle tightness, or PMS, consider magnesium status with your clinician. Sign number 5, irregular bowel patterns, especially constipation. The gut is a long, smooth muscle. Magnesium helps that muscle coordinate gentle weaves that move food along. When levels are low, motility can slow. If stool is consistently dry or you strain often, hydration, fiber, and magnesium may all deserve attention. Sign number 6, heart rhythm awareness, extra beats under stress or a sense of pounding after coffee. Magnesium participates in the movement of calcium and potassium inside cardiac cells. Low stores can make the heart more sensitive to stimulants, dehydration, or anxiety. Any persistent palpitations require medical evaluation, but magnesium status is a common part of that conversation. Sign number 7, insulin-resistant signals, energy crashes after high-carb meals, intense sugar cravings, or expanding waistline despite similar calories. Magnesium helps insulin escort glucose into cells. Insufficient magnesium can worsen blood sugar swings, amplifying fatigue and cravings. People with prediabetes or type 2 diabetes often benefit from checking and optimizing magnesium intake with professional guidance. Now that we've named the 7 signs, let's talk about why deficiency is so common and what you can do gently and safely. Modern soils are less mineral-rich. Ultra-processed foods contain little magnesium. Alcohol, chronic stress, PPIs, some diuretics, and high-dose calcium without balance can lower levels further. Athletes and heavy sweaters also lose magnesium through sweat. Food first. Magnesium-rich choices include leafy greens like spinach and chard, pumpkin seeds, almonds, cashews, peanuts, dark chocolate with high cocoa content, black beans, edamame, tofu, avocado, oats, quinoa, and whole grains. A simple daily practice: build at least 2 meals that visibly include greens and a handful of nuts or seeds, plus beans or whole grains several times a week. Hydration matters. Mineral waters containing magnesium can meaningfully add to intake. If you drink coffee, pair it with water because caffeine can increase urinary loss. What about supplements? Forms differ. Magnesium glycinate or biglycinate is gentle on the gut and supports relaxation and sleep. Magnesium citrate tends to support bowel regularity. Magnesium malate may help people with muscle fatigue. Magnesium oxide has lower absorption but can help constipation in some cases. Typical supplemental ranges are 1 to 300 milligrams of elemental magnesium daily, adjusted with professional input based on diet, kidney function, medications, and symptoms. If you have kidney disease, pregnancy, or are on specific medications, consult your clinician before supplementing. Let's connect signs to practical actions. For muscle cramps, evening magnesium glycinate, gentle calf stretching, better hydration, and a banana or pumpkin seeds can help many people. For sleep, dim light 1 hour before bed, a warm shower, slow breathing, and magnesium 30 to 60 minutes before bedtime. For anxiety or stress spikes, brief outdoor walks, box breathing, inhale for 4, hold for 4, exhale for 6, and steady magnesium intake across the week. For headaches, track triggers. Keep regular meals, hydrate, and discuss magnesium with your clinician. especially if headaches cluster around hormonal shifts. For constipation, increase fiber gradually, drink more water, and consider magnesium citrate in the evening as advised by your provider. For heart rhythm sensitivity, limit stimulants, rehydrate with electrolytes as needed, check magnesium and potassium with a professional, and seek medical evaluation for persistent palpitations. For insulin-resistant signals, anchor each meal with protein, fiber, and healthy fats. Add leafy greens and nuts daily, walk 10 to 15 minutes after meals, and optimize magnesium intake. How do you know if magnesium is low? Blood magnesium tests can miss tissue depletion because most magnesium lives inside cells or bone. Clinicians often consider symptoms, dietary patterns, and sometimes order additional tests such as RBC magnesium. The safest approach is a combined strategy: improve diet, manage stress, and, if appropriate, try a well-tolerated supplement with professional guidance while monitoring how you feel. Let's create a simple weekly plan. Choose 2 breakfasts rich in magnesium. For example, overnight oats with chia seeds and almonds, or a spinach omelet with avocado. For lunches and dinners, rotate bowls that include greens, beans, and whole grains. A quinoa, black bean, and roasted veggie bowl with pumpkin seeds, or tofu stir-fry with edamame and brown rice. Keep a small container of mixed nuts and dark chocolate squares for a satisfying, mineral-rich snack. Drink water through the day, and consider a magnesium-containing mineral water with meals. Add gentle strength training or yoga twice a week to improve insulin sensitivity and reduce stress. Both protect magnesium status. Before we close, a quick recap of the 7 silent signs. 1. Muscle tension, cramps, or twitching. 2. Difficulty falling asleep and waking unrefreshed. 3. Anxiety, irritability, or heightened stress response. 4. Headaches or migraines. 5. Constipation or slowed motility. 6. Heart rhythm sensitivity or palpitations under stress. 7. Insulin resistance signals, such as post-meal crashes and cravings. Remember, one sign alone does not prove deficiency, but several together, especially with a low magnesium diet and high stress, deserve attention and a conversation with your healthcare professional. Thank you for taking this time to care for your health. Small, steady steps, more greens and beans, a handful of nuts, better sleep, calmer days, and thoughtful magnesium support can change how you feel within weeks. I appreciate you being here. See you in the next video.
Hello and welcome. Today we're going to explore one of the simplest yet most important topics for your health: water. Every single cell in your body depends on water to function properly. Yet many of us walk around every day in a state of mild dehydration without even realizing it. You might think, I drink coffee, tea, maybe some juice during the day, so I should be fine. But the truth is, your body often doesn't get the amount of pure water it actually needs. And when this happens, it begins to send you signals, warning signs that you are not drinking enough water. In this video, I'll explain 7 key signs your body uses to tell you it's dehydrated, how to recognize them early, and what you can do about it. Stay with me until the end because some of these signs may surprise you, and learning about them today could have a big impact on your health and energy tomorrow. Let's start with the first warning sign: persistent fatigue and lack of energy. Many people blame tiredness on lack of sleep, stress, or overwork. While these can certainly contribute, dehydration is one of the most overlooked reasons for feeling drained. Here's why. When you don't drink enough water, your blood volume decreases slightly. This means your heart has to work harder to pump oxygen and nutrients to your muscles and brain. As a result, you feel sluggish, weak, and mentally foggy. Think about the last time you had a headache in the afternoon or felt too tired to concentrate. Chances are, drinking a glass or 2 of water might have helped more than another cup of coffee. Hydration helps restore circulation and keeps your energy levels stable throughout the day. The second warning sign is headaches. Dehydration reduces the amount of fluid surrounding your brain and spinal cord, which act as cushions to protect your nervous system. When these fluids are low, the brain can temporarily contract or pull away from the skull, triggering pain. Many people immediately reach for painkillers when a headache strikes, but often the solution is as simple as drinking water. Studies have shown that even mild dehydration can trigger migraines or tension headaches. If you notice that your headaches tend to appear in the afternoon or after physical activity, dehydration could be a major factor. Next time you feel that familiar tension building, try drinking 2 glasses of water and waiting 15 minutes before taking medication. You may be surprised by the results. The third warning sign is dry skin and lips. Your skin is the largest organ in your body, and it contains a significant percentage of your body's water. When you don't hydrate enough, your body prioritizes internal organs like the heart and brain, and your skin becomes one of the first areas to show signs of deficiency. This can manifest as flakiness, itching, or loss of elasticity. Chapped lips are another classic indicator. People often reach for lip balm or moisturizer, but unless you address the root cause, dehydration, the dryness will continue to return. Drinking enough water helps your skin stay elastic, improve circulation, and can even reduce the appearance of fine lines and wrinkles over time. So, if your skin looks dull despite good skincare products, it may not be the cream you're using, it may be the lack of water inside your body. The fourth warning sign is digestive problems, especially constipation. Water plays a vital role in moving food through your intestines and keeping stools soft. Without enough water, digestion slows down and stools become harder and more difficult to pass. Chronic dehydration can lead to bloating, irregular bowel movements, and even increase the risk of developing hemorrhoids. Fiber-rich foods like fruits, vegetables, and whole grains are important, but they only work properly when there's enough water to help move that fiber through your system. So if you're eating healthy but still struggling with digestion, dehydration might be the hidden culprit. Drinking adequate water each day helps keep your digestive system running smoothly and reduces discomfort. The fifth warning sign is joint and muscle pain. Did you know that about 70 to 80% of your joint cartilage is made of water? This fluid acts like a cushion, absorbing shock and reducing friction when you move. When you're dehydrated, this cushioning wears thin and your joints may feel stiff or painful. Similarly, muscles require water to contract efficiently and remove waste products like lactic acid. Without proper hydration, you might experience cramps, spasms, or soreness even after light activity. Athletes know that staying hydrated is essential for performance and recovery, but this is just as true for anyone with an active lifestyle or even for older adults who may experience stiffness. If you wake up feeling achy or your knees hurt after a short walk, try increasing your water intake before assuming it's just age catching up with you. The sixth warning sign is bad breath and dry mouth. Saliva is your body's natural defense against bacteria in the mouth. It washes away food particles, neutralizes acids, and prevents microbes from multiplying. When you're dehydrated, your saliva production decreases, creating the perfect environment for bacteria to thrive. This can result not only in bad breath, but also in higher risk of cavities and gum disease. Many people try to mask bad breath with mints or gum, but if the underlying issue is dehydration, these are only temporary fixes. Drinking water consistently throughout the day helps maintain saliva production, keeps your mouth fresh, and supports overall oral health. The seventh and final warning sign is frequent urinary tract issues. Your kidneys rely on water to filter waste from your blood and maintain a healthy balance of electrolytes. When you don't drink enough, your urine becomes more concentrated and darker in color. This not only irritates your urinary tract, but also increases the risk of infections and kidney stones. A simple way to check your hydration status is to look at your urine. Pale yellow usually indicates proper hydration, while dark yellow or amber suggests dehydration. If you frequently experience burning sensations, discomfort, or infections, increasing your water intake may help prevent these problems before they become serious. Now that we've covered the 7 main warning signs of dehydration, fatigue, headaches, dry skin and lips, digestive problems, joint and muscle pain, bad breath, and urinary tract issues, let's talk about how much water you actually need. The classic advice is 8 glasses a day, but the truth is your needs depend on factors like body weight, activity level, climate, and diet. A good rule of thumb is to aim for about 30 to 35 milliliters per kilogram of body weight. For an average adult, that's roughly 2 to 3 liters per day. But remember, this includes not only drinking water, but also water from foods like fruits and vegetables. Watermelon, cucumbers, oranges, and leafy greens all contribute to your hydration. So, how can you make sure you drink enough water every day? First, start your morning with a glass of water. After hours of sleep, your body is naturally dehydrated. Drinking water first thing in the morning jumpstarts your metabolism and helps you wake up. Second, carry a reusable water bottle with you throughout the day. Having water within reach makes you far more likely to sip regularly. Third, set reminders on your phone or use a hydration app. Many people simply forget to drink, and a gentle reminder can make a big difference. Fourth, balance your intake of caffeinated and alcoholic drinks. Coffee, tea, and alcohol all have mild diuretic effects, meaning they increase fluid loss. For every cup of coffee or glass of wine, try to add at least 1 glass of water. Fifth, listen to your body. Thirst is an obvious signal, but by the time you feel thirsty, you're already mildly dehydrated. Pay attention to more subtle cues, like dry lips, fatigue, or trouble focusing. Let's also address a common myth. Can you drink too much water? While it's rare, overhydration is possible, especially if you drink large amounts of water very quickly without balancing electrolytes. This can dilute sodium in your blood, leading to a condition called hyponatremia. Symptoms include nausea, confusion, and in severe cases, seizures. The key is balance. Don't force liters of water down at once. Instead, sip steadily throughout the day and let your thirst and urine color guide you. Another important point is the role of hydration in weight management and appetite control. Sometimes your body confuses thirst with hunger, leading you to snack unnecessarily. Drinking a glass of water before meals can help control appetite and support weight loss goals. Water also helps improve metabolism slightly, making your body burn calories more efficiently. If you're trying to lose weight or simply maintain a healthy lifestyle, staying hydrated is one of the easiest and cheapest strategies you can adopt. Let's recap the key messages. Dehydration is more common than most people realize, and it affects your body in many subtle but important ways. The 7 main warning signs to watch out for are fatigue, headaches, dry skin and lips, digestive issues, joint and muscle pain, bad breath, and urinary tract problems. By recognizing these signals early, you can prevent more serious health issues and improve your overall well-being. The solution is simple. Drink enough water consistently throughout the day. Aim for 2 to 3 liters, depending on your size and activity level, and remember that healthy hydration habits are built gradually. Thank you so much for watching. If you found this video helpful, please give it a like and subscribe for more doctor-approved health tips. In upcoming videos, we'll talk about other essential health topics, from stress management to boosting your immune system. Until then, stay hydrated, stay healthy, and I'll see you in the next video.
Hello and welcome, and thank you for being here today. Over the next hour, we are going to talk about something that literally keeps you alive every second of your life: your heart. It beats more than 100,000 times a day, pushing blood and oxygen to every single cell of your body. It never takes a break, it never stops, and it works tirelessly for you from the moment you were born until the very end of your life. Yet despite how important this organ is, so many people unconsciously treat it badly every single day. I'm talking about the small daily habits that slowly but surely damage your heart over the years. You may not notice anything today. You may feel fine in your 30s or 40s, but by the time you reach your 50s or 60s, the damage may already be severe. That is why it is so important to recognize these habits early and understand how they affect your cardiovascular system. In this long session, we are going to explore 5 everyday habits that damage your heart, why they are so harmful, and what you can do to break free from them before it's too late. Let us begin with the first major habit: living a sedentary lifestyle. Modern life has made it easier than ever to move less. Many of us work in offices, sit in front of computers, spend evenings watching television, and use cars or public transport instead of walking. The truth is that your heart is a muscle, and just like any other muscle in your body, it needs regular exercise to stay strong. When you spend most of your day sitting, your heart does not get the workout it needs. Your circulation slows, your blood vessels stiffen, your metabolism weakens, and your risk of developing high blood pressure, obesity, and diabetes skyrockets. All of these are major risk factors for heart disease. Studies show that people who sit for more than 8 hours a day without regular physical activity have a significantly higher risk of cardiovascular problems and even premature death. The scary part is that many people think a short trip to the gym once or twice a week makes up for hours of sitting, but the research tells us that's not enough. Your heart needs consistent daily movement. Even small changes like standing up every hour, walking for 15 minutes during lunch breaks, taking the stairs instead of the elevator, or doing light stretching can make a huge difference over time. Think about it this way: your heart rewards every step you take. The second destructive habit is eating poorly. Your diet has a direct and powerful effect on the health of your heart. Unfortunately, the modern diet is often filled with processed foods, high amounts of sugar, excessive salt, and dangerous trans fats. Let's break this down. Sugar is everywhere. Sodas, candies, pastries, sauces, even foods that look healthy. Excess sugar causes spikes in blood glucose, forces your pancreas to overwork, increases fat storage, and contributes to obesity and diabetes, which in turn put enormous strain on your heart. Salt is another hidden danger. While your body does need some sodium, too much leads to water retention and increased blood pressure. High blood pressure is known as the silent killer because it often has no obvious symptoms until it damages your arteries and forces your heart to pump harder. Then there are trans fats, found in fried foods, margarine, and many packaged snacks. These fats increase bad cholesterol, lower good cholesterol, and clog your arteries like sludge in a pipe. Over time, your arteries become narrower and harder, making it more difficult for blood to flow. The result can be a heart attack or stroke. On the other hand, diets rich in vegetables, fruits, whole grains, lean proteins, nuts, and healthy fats from sources like olive oil and fish can dramatically reduce your risk. The Mediterranean diet, for example, is well studied and known to support cardiovascular health. The bottom line is that every bite you take is either helping or hurting your heart. The third habit is smoking and excessive drinking. Cigarette smoke contains thousands of harmful chemicals that directly damage the lining of your arteries, increase blood pressure, reduce oxygen supply, and promote clot formation. Every puff of smoke is like a toxic assault on your cardiovascular system. Even secondhand smoke increases the risk of heart disease for people around you. Alcohol is more complicated. In small amounts, some studies suggest it may not be harmful, but excessive drinking weakens the heart muscle, raises blood pressure, increases triglyceride levels, and can trigger irregular heart rhythms. The problem is that many people underestimate how much they drink. Having a few drinks every evening, going out on weekends, or regularly consuming more than the recommended limits slowly damage your heart and liver. If you smoke and drink heavily,